you so much for this opportunity to appear before you. You hear from 3 consumers who are using their personal stories to try to help advance systemic changes. These 3 pieces of legislation will go a long way to improving quality for the residents of Massachusetts. So thank you.
As simple as the 19-item checklist is, the result of its use in hospitals suggests a cut of at least 39% of all the surgical complications. Overall rates of surgical site infection and unplanned reoperations significantly drop with use of the surgical checklist. Post-operative complications and death rates all show similar reductions. This bill gives us a chance to change the delivery of our health care. If a checklist had been used during my second surgery, perhaps I would not have to endure another 28 surgeries over following 5 years with amputation of my left leg, the only alternative to save my life. I tried hard to fight the strain of staph called osteomyelitis that was introduced during that surgery. In my case, there was no checklist. And during the second surgery, nobody would keep up on it. This bill will give hospitals another tool to use so that every patient has a better chance than I did for a full recovery without complications.
This particular bill seeks to reduce infections by requiring healthcare facilities to screen high-risk patients upon admission for methicillin-resistant Staphylococcus aureus, otherwise known and easier to say, MRSA, and take precautions for those who test positively to avoid the spread of infections throughout our healthcare institutions. I'm testifying in support of this bill because my life was forever altered as a result of MRSA infection. In 2005, my father, a 72-year-old, otherwise healthy man, went to a prominent healthcare institution in the greater Boston area to have a routine surgical procedure to remove kidney stones. He contracted MRSA and became one of the 94,000 individuals who acquired this deadly bacterium each year in the United States, and one of the 19,000 who die as a result of it.
Labor and delivery down in the first floor, our team of doctors made a really basic misdiagnosis. And my wife got the wrong drug for 12 hours, and she didn't get any pain medication for the first 12 hours that she was in labor. They thought it was gas pains. We never formally reported either one of these 2 drug errors. Our son was in the neonatal intensive care unit for 3 weeks, so we really couldn't think about anything else. I'm bringing up this story now to make a simple point. The vast majority of medication errors are never formally reported within the hospital. It's only about 2% are. To find out about medication errors, you have to ask patients. The expert panel that's required in this bill can do that. Back in 1999, there was tremendous shock, and Amy mentioned the finding from the Institute of Medicine study that 98,000 people were found to be dying of medical errors every year, 14,000 of them every year for medication errors. And then 7 years later, 7 years, we were shocked again to learn from the IOM that 1.5 million people suffer injuries, as you mentioned, from preventable drug errors. So in 7 years, it seemed that things didn't improve very much. So we need to fix this. We need an independent panel of experts, which this bill requires, to review what has been learned, what works, and to make formal recommendations within a year, and to embed them in law, and to ensure that there's sufficient reporting and oversight to stop the harm to people and this waste of money.